Hey everyone, welcome back to the channel. Today, we're diving into a concerning topic that's been making waves recently, Human Metapneumovirus, or HMPV. This is something you might not have heard much about, but it's important to understand because it affects millions of people every year. We'll talk about what it is, the symptoms, how it spreads, and what you can do to protect yourself and your loved ones. Before we get into it, let me add a quick disclaimer. The information I'm sharing today is based on the most reliable and up-to-date sources available at the time of this recording. For personalized medical advice or the latest updates, always consult with a healthcare professional or refer to official health organizations like the CDC or WHO. So, what exactly is HMPV? Human Metapneumovirus is a respiratory virus first identified in 2001, though scientists believe it's been circulating in humans for decades. It belongs to the Pneumoviridae family, closely related to the more well-known respiratory syncytial virus, or RSV. HMPV is one of the leading causes of respiratory infections, particularly in young children, older adults, and people with weakened immune systems. It's more common than you might think and can cause anything from mild cold-like symptoms to severe respiratory illness. The symptoms can vary depending on the individual. For some, it's just a mild cough or runny nose. Others might experience fever, sore throat, wheezing, or even difficulty breathing. In severe cases, especially among vulnerable groups, it can lead to bronchitis or pneumonia, which can be life-threatening. That's why understanding and addressing HMPV is so critical. How does it spread? Like most respiratory viruses, HMPV spreads through respiratory droplets when an infected person coughs or sneezes. It can also spread by touching surfaces contaminated with the virus and then touching your face, especially your nose, mouth, or eyes. This makes it highly contagious, particularly in crowded spaces like schools, nursing homes, and hospitals. Now, you might be wondering, how is it diagnosed and treated? Doctors usually look at symptoms and may use lab tests like PCR to confirm the presence of the virus. Unfortunately, there's no specific antiviral treatment or vaccine for HMPV right now. Most treatments focus on managing symptoms, things like staying hydrated, getting plenty of rest, and using over-the-counter medications to relieve fever and pain. In severe cases, especially for people struggling to breathe, hospitalization might be necessary for oxygen therapy or other supportive care. But here's the good news. There are ways to prevent it. Basic hygiene plays a huge role in stopping the spread of HMPV. Wash your hands regularly with soap and water for at least 20 seconds, or use hand sanitizer if you're on the go. Avoid close contact with people who are sick, disinfect frequently touched surfaces, and cover your mouth and nose when coughing or sneezing. If you're not feeling well, do everyone a favor and stay home. Prevention is all about those small, simple habits that make a big difference. Recently, there's been a spike in HMPV cases, especially in East Asia, and health authorities are paying close attention. The rise aligns with typical seasonal patterns, but it's a reminder that respiratory viruses are still a global health concern. It's especially important to stay vigilant if you or someone close to you is in a high-risk group. To wrap this up, HMPV might not get as much attention as other respiratory viruses, but it's something we all need to be aware of. By understanding the symptoms, how it spreads, and the steps we can take to prevent it, we can protect ourselves and those around us. And remember, even if there's no cure or vaccine right now, knowledge and preventive measures are our best defense. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more content like this. Stay informed, stay healthy, and let's keep looking out for each other. Thanks for watching, and I'll see you in the next one.